Well, which would you prefer, a zillion crunches or a few pulses? Well, we're talking about body contouring today with the Body Contour Doc, Dr. Donald Balder. How are you, sir? Good to see you again.
Jim. Good to see you.
Tell us about this new system you have, the Ultra Shape.
Yeah, so the Ultra Shape is a great system for folks that have unwanted fat cells that they can't get rid of. They've exercised, they've dieted. The problem with diets are that the fat cells shrink, and then when you get off your diet, they come back again. So without any incisions, without liposuction, without tummy tucks, we can do a mommy makeover. We can get rid of some of these fat cells pretty diligently with this pain-free system.
And it's a pretty cool system. It's basically all about body contouring. There's a couple of parts to it. You can do one or you can do the other, or you can do a combination of both. And yes, I have volunteered to be the one that they show you on. We're going to show you exactly how you can lose some of those unwanted inches here with the Body Contour Doc. All right, I'm all set up for this, but first, talk about this machine here, Dr. Balder.
So this is our VeloShape 3 machine. This is going to use the ultrasound technology to tighten the skin, and also it will burn some fat, so we can use it on the abdomen, we can use it on the saddlebags, we can use it on the legs, anterior, posterior. We can do a Brazilian butt lift and tighten up the buttocks with it. We can do under your chin, although under the double chin it will bruise a bit. That's the only part of the body this may cause some bruising. But it's a state-of-the-art device to significantly tighten skin, and also will burn some fat underneath the skin, and of course with the heat that it generates, employ a lot of the lymphatics to help get a lot of those fat cells out of the way.
Okay. So now this system here that you've got me hooked up to do, talk about it. This is the body contour part.
This is well, they both are. This is a little bit less expensive, so somebody who might not be able to afford the Ultra Shape machine might choose to use the VeloShape 3 instead, or might want to use it on several areas like the abdomen, the buttocks, the thighs, and so forth. This is going to be our fat burning machine, our Ultra Shape 3, and it's a very sophisticated machine where we're going to use radio frequency on the abdomen, on the legs, on the thighs, and we're going to employ this over several focal zones which the computer here generates and tells us exactly where to go. We can do a single layer, or we can do a double layer. What I mean by that is this will vibrate the fat cells at 1.5, 1.45 centimeters underneath the skin, such that they vibrate so fast that they burst.
Really?
We have a double mode where we can do two different levels, very, very close to each other. So we can theoretically burn more fat with that treatment, the double layer. And basically they vibrate so fast that they burst, and then the lymphatic system will swallow them up, bring them to the liver, and they'll end up out of your body through a bowel movement. So we can get rid of this fat in this accord. Basically, this will not injure any nerves. This will not injure your skin. This will not burn your skin. This won't injure any blood vessels, so you won't have any bruising. You can get up after this therapy and go back to work. You can get up after this therapy and go work out at the gym. So this doesn't have any detriments in that case at all. But this is exactly how it works or looks when we go to set up an abdomen. This device here is scrunched the tissues together as best we can.
Yeah, I got fat rolls.
But not that it looks more when we're scrunching it together than you actually have standing up, because we're bringing a lot of tissues in one small area to get the needed result. Of course, before we come here, we measure you in our measurement room. We take preoperative and postoperative photographs. But a typical patient is going to come here every 2 weeks for 3 therapies. So in 1 month, you're going to have 3 therapies on this area. And in the next four weeks after that, you're going to get your dramatic result, which is 1 to 2 sizes, several inches, especially if you follow the diet and exercise regimen, which is minor, but I recommend that you do with these therapies. Again, the biggest thing that's great about this is it's not just a diet. The fat cells are not shrinking. They are permanently removed from your body like they would be with liposuction, but with no anesthesia needed, with no downtime, with no cuts, with no infections, no healing issues, no bleeding.
So it's not invasive at all?
Non-invasive at all. You know, even in the best of hands, some liposuctions cause dehydrated. Some patients have to be admitted to the hospital for blood transfusions. This can be done on patients who have had previous liposuction. Sometimes there's areas that aren't perfectly smooth the patient wants us to work on. And so this can be done in almost all patients. The big contraindications are pregnancy and a pacemaker. Those are really the only 2 big contraindications for the device. Again, it's been FDA cleared for about a year. really no detrimental problems that it has. When we are doing the therapy, I noticed when I trialed it on myself that in the single mode, you don't feel a thing. On the double mode, which is going to burn 2 layers of fat, you feel almost like a TENS unit, almost like a little tiny shock, but tiny minuscule. You just you know something's there, but doesn't cause any pain.
It's not real painful. No,
not at all.
No. So as you run that over me, it's basically, as you said.
Yeah, we're going to have gel, and we're gonna zap all the different focal zones. The computer here keeps track of the focal zones, and the computer will tell me when the treatment's done. It'll, over the course of treatment, we're usually listening to some quiet music, talking a little bit, and
How long does the treatment usually take for something like this?
For something, this would probably take about 45 minutes.
Okay.
Now, one thing that we do offer that's very special is that we don't just offer the UltraShape. For people that buy the UltraShape packages, we throw in the VelaShape with it.
Oh, nice.
And so some of the higher end boutiques like in Hollywood and so forth, what that's going to do is that's going to start tightening your skin right away. That's going to warm up the lymphatics. It's going to warm up the fat so that we'll get a better result from doing both together. So we'll start the treatment with the VelaShape 3 for 5 to 7 minutes. We'll do our 45-minute treatment, and then we'll finish with another 5 minutes. So I think we're giving the patients just the state-of-the-art, best possible result they can possibly get. Of course, we do a preoperative consultation, and the consultations are free. If I think that you need to be on a diet for a short time first, or if I think a tummy tuck is a better option, or even a liposuction might be better indicated, we'll send you to the right people for that.
Now, you have coming up on October 22nd, you have a special open house from noon to 7 here that you're going to be talking to people about this, and also about you have some special offers for them.
We do. We have some dramatic price decreases. If you sign up between now and the open house, you get at least 20% off your therapy is what we're running. And the hope is that we can really start helping people. The season where people start indulging, the football season is coming upon us. I kind of say, why wait until January to start getting the results in, to start doing a little bit of exercise and start eating a little bit better. But this is really going to help a lot of people in our area. It's the only machine in Mississippi.
Well, I'll tell you what, they're located in the medical building just on the east side of Garden Park, 2nd floor. And just call, the number's on your screen, call and make yourself a reservation, because there's going to be, probably limited room on there. But if you want to find out more about this great body contouring system, come to the open house, October 22nd from noon to 7. Here it's Dr. Donald Balder. Well, they call it the Contour Doc. So come and get your body contoured here at his office.